Hello, everyone. Welcome to Refugee Welcome Collective Lunch and Learn series. In these sessions, we aim to bring you timely and interesting information. Whether you are a volunteer, community sponsor, resettlement agency staff, local advocate, or just someone who's interested in learning more, we hope that you enjoy today's session, Navigating Self-Sufficiency Challenges in Refugee Support. Refugee Welcome Collective collaborates with partners to provide in-depth training programs, weekly training sessions, resources and on-demand technical assistance for sponsors, resettlement agency staff, refugees paired with sponsors, community and institutional partners, and others to support quality community sponsorship programs across the United States. And just for a reminder, for housekeeping, everyone on today's webinar is automatically muted. However, toward the end of our webinar, we're going to have time for Q&A. So you can come off mute and ask your questions. And throughout the webinar, you are definitely welcome to drop off your questions in the chat or in the Q&A time. You can also ask your questions live. And that will take us to our presenters for today. Christine Baer, who is the Associate Director for Remote Placement with CWS, and Katie Randall, Associate Director for Neighbor Network with CWS. Thank you all for joining us, and we can start now.
We can go to the next slide. Thank you so much, Joy and Refugee Welcome Collective, for bringing us all together today to discuss such an important topic, and such a topic that we could discuss for quite some time. So Katie and I are going to be looking to provide some very specific objectives and goals during this time together today, and really explore first and foremost, what the concept of self-sufficiency looks like, particularly in regards to the U.S. Refugee Resettlement Program. We hope that you all gain confidence in communicating through different self-sufficiency goals between volunteers and sponsors, agency staff, and clients. And we hope that you learn strategies for navigating challenges in self-sufficiency as we're working to align our different understandings of what self-sufficiency means. We can go to the next slide. So let's dig into some of the content here. We want to start off today's presentation by acknowledging what self-sufficiency is through the lens of the Reception and Placement Program. Now, the Reception and Placement Program, or RNP, is, of course, the federally designated, specific program for refugees arriving to the country. We will be discussing later in our presentation kind of the nuance of differences in expectations with self-sufficiency, particularly as multiple different forms of groups are working with refugee arrivals, whether that is, staff of an RNP program, or sponsors and volunteers who are sometimes working with staff of an RNP program, but also sometimes coming alongside of refugee arrivals in day-to-day operation. Maybe you are volunteering for a school district where refugee arrivals have children and are attending the school, but you are not volunteering through the Reception and Placement Program. So you can start to see how there's different stakeholders that come into the conversation of what is self-sufficiency when it comes to refugee assistance. But here, let's just kind of like gloss over some high-level points on what does self-sufficiency mean for the RNP program. First and foremost, many of y'all are going to be familiar with the fact that the RNP program is time-bound. There is a, for the sake of uniform programming across every refugee arrival who comes to the country, there is an attempt to say, there is a 3-month time period for these first services to be delivered to refugees. That means there is going to be very specific timeframes that staff of RNP programs and volunteers of RNP programs are working to achieve very specific transition tasks and goals for refugees. That is going to be specifically focusing on applying for government benefits, being able to teach a newcomer to understand the mechanics of paying bills and how to pay their rent, helping to acquire employment for individuals, teaching tasks like cultural orientation, grocery shopping, riding the bus. The RNP program, for the sake of talking about self-sufficiency, talks about fast self-sufficiency, meeting these kind of goals of the program in a quick time frame, wanting to make sure that staff and volunteers of the RNP program are working with refugee arrivals in those first 3 months on these items. So once again, we're going to explore self-sufficiency through the lens of other stakeholders in just a few slides, but wanting to open us up by talking about the reception and placement program. We can go to the next slide. Why is self-sufficiency important? In particular, these first 3 months of after arrival in the RNP program, self-sufficiency is considered, and it's repeated a lot if you are a staff of the program, or if you're a volunteer, you might be hearing the term self-sufficiency come up in your volunteer training or as you're discussing tasks that you're working with a newcomer on. And the reason why is due to these 3 kind of focus points up on the screen right now: agency building, decreased vulnerability, and stability. We know that the transition to a new community where you might not be fully understanding of the mechanics of day-to-day life, who to go to in order to inquire about your child's grade at school, how to talk to your supervisor about your benefits, where to go to if you have a question about low cost heating program that you heard a neighbor talk about. All of these items, understanding how to answer and solve those questions for yourself creates stability and foundation in your transition to a new community. It also makes builds the agency of a newcomer. It's makes it so that the newly arrived refugees have increased control and power over life goals. Even the most well-meaning of staff and sponsors, we are not fully sometimes aware of the long-term goals of an individual that we are working with, and if an individual's in control of the path that they are walking on in life, if they have all of the knowledge that is afforded to them, then they have an increased ability to control kind of the decisions that come ahead of them. We also want to make sure that we touch on decreased vulnerability. When you are not aware of the knowledge of how to interact and solve challenges in your community, you're at higher risk for being taken advantage of. Possibly that's scams. We all know that scamming in our communities is becoming sometimes more and more challenging to figure out whether or not somebody who comes to our house with an official form and a badge is in fact who they say they are. And we want to make sure that we are preparing newcomers in the lens of self-sufficiency in a way that decreases their vulnerability in their communities to individuals who would not be helping them. We can go to the next slide. There's a lot of text on this slide, but I want to hit some high points here. The role of staff and sponsors, and for the sake of sponsors, I'm going to say, if you find yourself in a volunteer capacity in any way, that would kind of come under the umbrella of sponsors. When we spoke about just a few slides ago, the RNP program, that the role of staff many times is to follow the specific program mandates that are outlined in cooperative agreements. So they are focusing on, a variety of different points throughout an individual's transition due to, how the program functions specifically, and trying to replicate the same type of service across a varying caseload of arrivals. So they might have a staff member in this role might be working on self-sufficiency goals for 15 different refugee cases or families. And we want to recognize that this top statement here, I think, is incredibly important when we're working in this space together, that we are all we all have very important roles in the transition of newcomers, that staff and sponsors and volunteers both do this work out of great passion and dedication for the care of refugees. So even when we are approaching our tasks in possibly a different lens or viewpoint, one is from a staff perspective, and one might be from a perspective of maybe having a little bit more freedom to navigate what tasks you're focusing on each week. We do that out of great dedication and care. And in just a few slides too, I think Katie is going to be discussing the great benefit that effective communication and working on aligning our understanding of how we are approaching self-sufficiency together really makes a difference here. Because it's not as though there is the staff understanding of self-sufficiency and there is the sponsor understanding of self-sufficiency and we are at odds with one another. I think we really do need to work on functioning together and welcoming together in a way that aligns our understanding so that we can just make sure that we're communicating effectively with one another. I do want to note that sponsors might be and we didn't really quite go over this nuance here, but you might be privately welcoming refugees through Welcome Corps, or you could also be partnered with a local refugee resettlement agency to welcome a family alongside of office staff. So there's a lot of varying nuance into how individuals are kind of coming into this space of welcoming newly arrived refugees at this point in time. But regardless of how somebody is getting involved, we do know that individuals have great passion and dedication, and we need to be sure to be communicating effectively with one another. I also just wanted to note here the role of staff and sponsors. In sponsors, many sponsors are able to focus on supporting fewer refugees at a time. They might not be holding, some sponsors do choose to welcome multiple families at a time potentially, but kind of across the board that assistance is at a fewer caseload, a smaller caseload than staff. I think we're going to go to the next slide now, and this would be when I hand the microphone over to Katie.
Thanks, Christine. All right, so now we have a good foundation for self-sufficiency and that definition and the different stakeholders, especially within the R&P program. And now in a font that is smaller than I anticipated, we're going to talk about the barriers to self-sufficiency. It's small so that you have to really pay attention to it. You got to like lean in and squint a little. All right, so let's talk about some of the barriers that we see in moving newcomers towards self-sufficiency, particularly in those first few months. And then we'll talk about, what it could look like beyond that time period as well. So the first one that I always go to is that there's that tension between a volunteer or sponsor's desire to provide humanitarian aid and the need for clients to become self-sufficient. Christine and I, between the two of us, have worked with a good number of sponsor groups. We were involved in sponsoring ourselves. And like Christine mentioned, everybody comes to this work out of a desire to do the most good they can. It is a drive towards humanitarian aid that brings people to this. And sometimes self-sufficiency and aid there's, like I mentioned, there's that tension there. I'm not going to say they're directly in conflict because there's a way to navigate both of those in that space. But when we think of self-sufficiency, we think of like, you're doing this for yourself. And when we think of humanitarian aid and charitable work, we think of, I'm doing this for you. And so we have to move through that and move through that tension, especially for volunteers and sponsors who may have never interacted in this kind of space before. And the additional stakeholder there is often the caseworker and the office staff who have done this quite a lot and can bring a different perspective and expertise to it. But for volunteers and sponsors, this may be the first time that they're participating in this kind of space. So that can quickly become a barrier to self-sufficiency because volunteers have such a strong desire to help and to provide, to do that work of helping someone adjust to life in the United States. And that can manifest as volunteers wanting to do something for a newcomer versus wanting to do something alongside of a newcomer. So this comes back to volunteer training and being trained about the purposes of sponsorship or volunteer work. But sometimes if the training's at the beginning of the sponsorship or before the sponsorship or before the family arrives, there needs to be a refresher of what is your role as a volunteer? Is it to do something for someone, or is it to provide tutoring or to walk them through how to do it? This sometimes comes into play when volunteers, if there's a phone call that needs to be made, and the volunteers are like, well, we get an interpreter and we could all do this, but I'll just make the phone call for you. It'll be easier. It'll be quicker. We really need to get this done because we're on this like short time frame, and this, we need to get these benefits activated, or we need to do this. I'll just make the call for you. Instead of kind of the more effective self-sufficiency move and practice, which is providing kind of a safety net while a newcomer tries or practices to do something on their own. I will sit with you while you make the phone call using the phrases that we practiced. We had tutors work on this particular scenario in our English language class. You are equipped to do it, and I'm going to sit here and help you through it if something else comes up. And sometimes this is because volunteers don't believe that the newcomers can do the task themselves. And they're seeing self-sufficiency almost as a deficit in agency or intelligence. This is something we talk to sponsors about quite a lot. It's not that people lack any sort of capability. We frame self-sufficiency as a process of learning new US systems. For those of us who have not been in that situation before, imagine if you were trying to learn a whole new system of accessing medical care in a country where you didn't speak the language and you weren't familiar with the culture. It's not that you weren't very good at doing that in the United States or wherever you came from. It's that you have to learn how to do it in a new place. So we always encourage sponsors and volunteers, again, who may be working in this space, in this resettlement space for the first time, to think of that process of helping someone move towards self-sufficiency, not as necessarily a deficit, but more of a learning process, and navigating our very complicated systems here: education, medicine, finance, banking, employment. All those are often complicated for people who have been born and raised here. So it's definitely a learning curve. There's also sometimes a barrier to self-sufficiency can be a lack of written literacy on the part of the newcomer. Sometimes folks come and they've never had a need for written literacy. They may speak multiple languages fluently, but in their home country did not have a need for written literacy. And sometimes that can be a struggle because US systems expect sort of a hyper literacy, that you can read and process a lot of information. So that can sometimes, especially in that very condensed self-sufficiency timeline expected by the RMP program, that can sometimes be a barrier. There also can be a newcomer reluctance to do certain things that would help move towards self-sufficiency in these US systems. So a reluctance to attend English language class regularly or work in particular jobs. And this can come from a number of reasons. And we could spend a whole day just talking about each of these barriers to self-sufficiency. Particularly this one, because sometimes on the sponsor and volunteer side, there may be a quick reaction of like, oh, there's a ingratitude, or there's a laziness, or there's some sort of reason why these things aren't happening. And this is something we always move people away from and towards a reframing of this, because that's almost never what it actually is. Sometimes there's a trauma. Of course, we know displacement is a trauma and resettlement is a trauma as well. And getting past that idea of thinking, oh, you're in the US now, you're safe, everything's fine, what's the problem? Resettlement in itself is often traumatic as well. There could be underlying mental health concerns, which again, understandably often come with trauma. There may be misaligned expectations about the United States. Sometimes, for better or for worse, the reputation or the reality of living in the United States is not represented authentically in some countries and in other places. And so they may come and think, I thought that I could work in this job that I was working in back home that I'm very good at. And there may be that process of explaining like that that may not be, we may have to work to that. That may not be the first job that you get in the United States. That may not be how that works. Or there may be cultural gender norms that we're working with in terms of moving towards self-sufficiency. We may have newcomers who have never had to work, and in their culture, it's not expected that they work. But in those sort of self-sufficiency expectations for the U.S. Refugee Resettlement Program, it is, or cost of living or things in the United States, it's now the expectation that there will be multiple income earners in a household or something like that. And then the one that I want to focus on more is the sometimes unclear definitions and goals around what self-sufficiency means. And when you're talking about multiple stakeholders existing in this space of self-sufficiency and the reception and placement program, you have staff, you have sponsors, you have volunteers, you have newcomers. Sometimes there's not that time taken to figure out, like, what is self-sufficiency? That's why we're here. What is self-sufficiency? Why is it important? What are our goals around what self-sufficiency is, and how? Let's get aligned on that same page. Next slide, please. And so I want to, Christine alluded to this, I want to revisit kind of what we think of as self-sufficiency. We talk about self-sufficiency as one of the primary goals of refugee resettlement in the United States. And at the same time, excuse me, at the same time, we often talk about community integration as more of kind of a long-term process. And sometimes we struggle to figure out where those concepts overlap and intersect. When we think long-term, when we think of community integration, self-sufficiency expands beyond kind of that financial stability of, like, do you have a job? Are you able to pay your bills? And into other areas. And not just that primary, like, can you get around? Can you get to the grocery store? Do you know how to take the bus? But really thinking of, like, what does it take to be self-sufficient long-term in the United States? So what does self-sufficiency involve beyond, making sure someone can pay their bills and get to work? We have this economic idea of self-sufficiency, which is often prioritized, but it can also be medical self-sufficiency. For example, being able to make appointments and fill prescriptions. Educational self-sufficiency, being able to communicate with a child's school. Social self-sufficiency, being connected in the community outside of resettlement volunteers, having a support system in that way. And moving towards these kind of self-sufficiency arenas often requires more time than the reception and placement program allows. I mean, I think we'd all agree that 90 days is a very short amount of time to be able to operate independently in a lot of these US systems and cultural expectations. This is where mindful sponsors and volunteers can assist with that. But it's a tricky balance to find. Not least because it can be very difficult to pin down a definition in these areas. When I was making this slide and thinking, what are examples of self-sufficiency in these different areas? I have my own ideas based on my own experience about what self-sufficiency can look like. But that's often not the case, especially, again, when someone may be operating in refugee resettlement for the first time. That can be very different from how staff approach the idea of self-sufficiency or how newcomers approach this idea. They may have a completely different idea of what self-sufficiency means because of their own cultural expectations and backgrounds. For instance, when I was working on my doctoral dissertation, I was a member of a co-sponsor group, and I interviewed volunteers in my group who were helping families learn to navigate the US medical system. These were specifically healthcare volunteers. And I asked them about their definition of self-sufficiency in, like, the medical system, like medical self-sufficiency. And I asked, what abilities or tasks would you look for in order to consider someone, like, medically self-sufficient? And I got a range of answers from them. Some thought medical self-sufficiency looked like knowing that you need to go to the dentist twice a year and how to make those appointments. Others defined it as including knowing how to coordinate your medical care team effectively, right? If you as a newcomer have 5 or 6 medical specialists working with you on a certain for certain needs, you as an individual know how to manage that effectively. Others thought that it should know how to, like, call Medicaid and switch your managed care organization and know how to navigate insurance and what that means. And interestingly, a lot of them, bring to that, and a lot of people, when they think about self-sufficiency, they think about themselves and they think about kind of the people in their social circles in the United States. And it's always worth considering that sometimes the expectations placed on newcomers go above and beyond what a lot of people born and raised in the United States do in their own lives. Would we consider someone born and raised in the US not self-sufficient because they don't go to the dentist twice a year, for instance? So sometimes in that desire to help and to help someone resettle in the US, we have there is often a higher kind of hurdle that we expect someone to clear in order to consider them self-sufficient. And this will take us into our next slide. So talking about success and self-sufficiency and managing those expectations. The ambiguous definitions of self-sufficiency, especially when we're thinking about long-term community integration and those other arenas, make it especially important for stakeholders to be aligning expectations about goals and timelines. If everyone involved isn't agreeing on a definition or outcome, or if those haven't been made explicit, volunteers may have differing opinions about self-sufficiency that influences how they support newcomers. They may resent staff for not being willing or able to provide the same intense level of support that they think is appropriate. Sponsors and volunteers are sometimes at newcomers' houses frequently. They're seeing where there are still certain gaps in knowledge or certain needs. And they, are again bringing their expectations about self-sufficiency to those spaces and to that moment, and sometimes resenting staff for not providing the same level of support that they could provide as a volunteer. Excuse me. Meanwhile, staff bring a different perspective to this from working with dozens, if not hundreds, of different newcomer families. They have seen this play out a lot of different ways in a lot of different times. Whereas, again, sponsors may be doing this for kind of the first time. And what we've seen and what can be helpful is reframing and adjusting expectations between what we think of as self-sufficiency and what we think of as success, and really parsing out, either individually or as a group. Okay, where are my definitions here? What am I expecting of a newcomer? And is that a reasonable kind of initial expectation? That idea of success can be built on a foundation of self-sufficiency, but managing expectations can help sponsors, and like Christine, I'm using kind of sponsors and volunteers interchangeably here, focus on these immediate priorities first, like learning to call doctors' offices to make an appointment, versus which may be kind of an initial self-sufficiency benchmark and goal that everyone wants to set together, versus knowing which questions to ask the doctor and when and why. Basically knowing how to advocate for yourself in like a US, doctor's office. Or a self-sufficiency benchmark of like getting a job that can pay bills or supplement with cash benefits to pay the bills, versus getting a job in your desired field. That may be what a newcomer wants to be, that initial goal. And then managing those expectations and aligning those expectations around like, well, maybe self-sufficiency is being able to pay bills, but maybe long-term success looks like that. And how do we move from one and build on that to the other? Versus, or knowing how to deposit a check at the bank, and that does the job. The funds are in the bank account. But you may have volunteers that are like, well, no, they're not. We think self-sufficiency should be knowing how to navigate online banking. That's what needs to happen in order for self-sufficiency to be kind of that checkbox to be checked. So again, sitting with your own expectations as a volunteer, a sponsor, a staff member, a newcomer, and working together to figure out, okay, are we in alignment here? Are these reasonable expectations? Does this fall under kind of our shared understanding of what self-sufficiency looks like and the timeline for self-sufficiency? If we're thinking kind of longer term outside of just that 90 days of reception and placement, even if sponsors are in the picture for longer than that, there still is a timeline involved of, when will support taper? When will people need to be able to do things with less support? Next slide, please. And so this is an extension of that same idea, that aligning goals, and making sure that everyone is working towards the same kind of goals, and not that you have one stakeholder working towards kind of those short-term goals and prioritizing those short-term goals and what needs to happen in those 90 days versus sponsors working towards what they see as like that long-term, those long-term goals, and wanting to get right to that rather than focusing on the scaffolding. And that's a word I'm going to come back to in a little bit, the scaffolding for self-sufficiency in that initial resettlement period in the United States. If on the part of staff, managing expectations about how quickly certain things will happen and why. Again, you often are in a situation where sponsors are advocating for the client against what they see as unfair expectations. It's they don't know how to do that yet, and we shouldn't, we should be helping them more with that. And then this can be helpful in reminding sponsors of that agency piece, and making sure that desire to help isn't sort of pushing out that need to respect newcomer agency and bolster agency for those reasons that Christine mentioned earlier, so that folks are less vulnerable, and then they have a more robust ability to navigate things without needing volunteers or sponsors for all of those situations. What Christine and I like to talk to sponsors about is struggling productively. Productive struggle. So sometimes sponsors bring to this process a desire to never let newcomers struggle, which is completely understandable. You're helping someone in the United States, you're assisting them, you're moving them towards certain goals. And just like with any situation where you're wanting to provide assistance and support to someone, it's difficult when they're struggling, and it's difficult when there's something that they are still needing to learn. And sometimes the instinct there is to kind of swoop in and make the struggle go away, fix the problem, fix the challenge. But volunteers have to let go of that desire to avoid any sort of difficulty. And this goes back to that, and we'll talk about communication in a second, but that aligning expectations between all the stakeholders, talking about what does productive struggle look like, making sure everybody knows that will happen. That's a necessary and normal part of learning to navigate all these new systems in a new place. And, and it can be helpful for volunteers to talk to staff about this, because staff have that experience. When do you step in? When should we step in? And talking about that tension again between that humanitarian urge to avoid any struggle and to really help as much as you can because you have the ability to do so, versus that need to move towards self-sufficiency. And newcomers themselves know that RMP service delivery is only 90 days. Sometimes, the social networks are very strong, and they may be talking to people who have been resettled before them, who maybe didn't have a sponsor, or didn't have a co-sponsor. And so their support did end in 90 days. And they may feel a lot of anxiety about making sure that they know how to do everything, or that they have everything they need before that window closes. So there may be a need to get everything, or a desire to have everything done all at once. And good sponsor support, sponsors who have been trained well and know how to set good boundaries, can help extend the self-sufficiency safety net beyond 90 days. And we'll talk about that a little bit more on the next slide, and how to do that effectively. Next slide, please. Perfect. So navigating challenges. Christine and I are big fans of effective communication. This is always our go-to for problem solving and managing, especially situations where you have misaligned definitions and misaligned understandings. Really getting on the same page in terms of what's expected, what goal are we working towards, what definitions are we working with, can go a long way in resolving those tensions and those problems. Keeping channels open between staff, sponsors, and newcomers, going back to those shared goals and discussing whether certain actions are in alignment with those goals. This gives everyone a starting point for those conversations. Staff can remind newcomers and sponsors of their shared definitions of self-sufficiency, etc. And then Christine mentioned this earlier, but to reiterate, approaching this in these conversations with a charitable interpretation. Everyone involved is coming from a desire to help, and the difference of opinion is sometimes around what will help most. And so really parsing out what that is and what that looks like. But again, coming to the conversation with the understanding that people are here they're on the same team. They're here for the same purpose. It's just a matter of figuring out what can get us to that goal in the best way. Remembering that staff bring that expertise and experience to the table, that's the charitable interpretation. And then volunteers and sponsors bring the time and resources. That's the charitable interpretation for them. And these can all work towards scaffolding newcomer self-sufficiency, really utilizing the strengths that each stakeholder has and that the available resources and capacity. And then building a plan. We love a good plan. We love a scaffolded plan. That's also a word we use a lot with sponsors. We have our self-sufficiency goals in the plan, but then working backwards to set smaller goals. It's very common for there to be self-sufficiency plans that are done between staff and newcomers. And where sponsors and volunteers can help support that is that they often have the capacity to help help set the smaller goals that scaffold those bigger goals. We always emphasize that not expecting people to be able to meet big goals without scaffolding. So if there's the self-sufficiency goal that a newcomer will be paying all of their rent in 6 months, and a sponsor is going to be able to pay their rent for the first few months, but at month 6, the newcomer will be responsible for paying all of their rent. Scaffolding looks like setting shorter benchmarks to have them pay an increasing amount, maybe in month 2, and then in month 4 they pay a little bit more. And not just with that, scaffolding also looks like walking them to the office for the apartment complex where they can hand their check, or addressing the envelope and working with an ELL tutor to know how to address an envelope so that they know where that needs to get mailed, or going to the post office to get stamps to mail the check, or working with the ELL tutors to navigate an online portal if it has to be done electronically. And setting goals backwards from that as well. Okay, if they're going to be paying all of their rent at month 6, then not only do they need to have the financial ability to do that, but they also need to be self-sufficient in these other ways to be able to do that. So let's practice on month 3. Let's practice with a little bit more independence on month 4, month 5. And so breaking out that self-sufficiency plan with sponsors, volunteers, whoever is able to provide that longer term support, staff, and figuring out what scaffolding is needed for these goals. Or if we're working on that condensed timeline, if we've got those 90 days, then utilizing sponsors and volunteers to really scaffold within those 90 days, and doing a little bit less support over time to make sure that we aren't getting to day 90 and saying, okay, you're good, do everything yourself now, making sure we're utilizing the available resources to make sure that scaffolding is happening as best we can. And
Can I say something too here?
Yeah, please.
I just wanted to jump in here and state that we've had meetings where we've built a plan around self-sufficiency challenges post 90 days, plenty of times at this point. And in my scope of work, what has worked well is when staff, the sponsor, and the client all come together in a meeting. In my own work, it is a virtual meeting, it's remote, but I could see that being really, effectively done well in a local sit-down meeting at an office. If you are if it's just a sponsor group in Welcome Corps, the sponsor and the client working together closely to build a plan. But to sit down together with the client centered there in the conversation to build the plan all at one point, and to foundationally have the understanding that at the beginning of the set meeting that we are all here for the goal of supporting this individual or family in order to reach goals. Let's enter into the conversation in that regard, so that, if you're navigating a challenge together, if this has potentially, possibly at this point become a conflict between parties as well, that you are, one, acknowledging the challenge, but also at the same point trying to move the conversation past that challenge or conflict in order to action plan at the same time. So this could really be a tool to be beneficial to just keeping momentum moving forward in good collaboration with everybody. And once again, the client being there, the refugee individual being actively involved in that conversation too is key.
Absolutely. And we've geared this presentation towards sponsors working with staff themselves, people who may be sponsoring privately, and they don't really have local staff involved in these conversations. They're really navigating that self-sufficiency conversations without the input of local staff. And so if in those situations, making sure that when you're talking to newcomers that you have professional interpreters involved to really minimize miscommunications. That's a big part of this as well. And then also noting that, our CWS team, our neighbor network team, this is why we exist, is to provide help with these kinds of challenges for people who are sponsoring privately, whether for Uniting for Ukraine, processes for Cubans, Haitians, Nicaraguans, Venezuelans, or now Welcome Corps, supporting and being that staff support and being able, like Christine mentioned, to offer, and Christine does this with remote placement groups. Christine and her team are the staff there, and we provide that virtual and remote support. So if you're listening to this conversation going, well, we don't have any staff local to us that can really help us figure out how to align those expectations or make that self-sufficiency plan, we have resources for sponsors in that way as well, where we can provide that staff guidance. That's it for us.
Thank you so much. This is really insightful, and I love all of the examples that you both gave. Like, I love, Katie, how you were working with a group was from the healthcare perspective, and how everyone just gave different answers. And true, like we think about it as like, oh yeah, if we can make 2 appointments, like we don't expect this of us. We don't call it self-sufficiency for us, but this is an expectation or held or yeah, and Christine, I love how you also mentioned this, the involvement of all parties. It's not just the staff and the volunteers, the sponsor groups. It's the refugee or the client also being involved and giving a voice into how's that going to work for me too. It's not just like, okay, here's what we see is going to work for you. There you go. But being involved in the process. All right, so we are going to move toward our Q&A time, but before we get there, I would like to just take a minute. If you can just bring your phone and scan this QR code, we would love to hear your feedback about today's webinar and hear your suggestions for future Lunch and Learn topics. So please just take a minute to scan this QR code, or you can also find the link for the feedback in the chat. So please go there and just give us your opinion, how it went, and any suggestions for future topics. We're always looking for topics. Help me out here. I'm looking for topics all the time, and I would love to hear from you. And just as a reminder, additionally to this presentation, the presentation and any resources and a recording of the presentation today will be sent out to everyone following today's webinar. So we're just going to take a minute, and then we'll move to Q&A. And during this time, you can come off mute to ask your questions, or you can drop your questions in the chat as well. And Katie and Christine would be more than happy to answer your questions. All right, we can move to the Q&A. We already have one question in the Q&A box. Do you guys have access to that?
Yeah, I can provide an answer or a partial answer to it, and then Christine can offer some suggestions as well. So Marissa, I love this question. Suggestions to handle volunteers who have different expectations than our agency and case managers. We've recently had some challenges with explaining certain things are not emergencies and basic needs are being met, etc. And yeah, that goes back to that tension between, you know, volunteers or sponsors may be doing this for the very first time. So for them, this is all brand new, where staff are like, I've seen this exact scenario 10 times and I kind of know how this ends and I have the perspective that I bring to this. I was like in those conversations, and I love Christine's suggestion of being in the room for these conversations, and being in a room together is so helpful. I like to probe sponsors on, what are you afraid is going to happen here? Not in the way I just said that sounded a little like condescending, but like a genuine, like, talk me through, you know, why does this feel like an emergency to you? And, you know, sometimes sponsors are bringing their own anxieties of like, oh, well, you know, that it goes back to that productive struggle thing, right? Like, oh gosh, like something bad is going to happen to them if this isn't fixed. If I don't address this problem immediately, they don't know how to do it themselves. They won't be able to. Something bad is going to happen. And so I really like to get with volunteers, I like to get to like the heart of the concern and ask, you know, what are you afraid will happen? And then also using storytelling as a good persuasive resource, and talking to them about the experiences you've had with other clients in that same scenario, and that it wasn't an emergency and it wasn't the end of the world. And you know, that family is doing great and they were able to do XYZ, and they learned that, you know, and they're also, the family and the newcomers are also learning like what kind of constitutes an emergency and what doesn't. And talking to them about kind of a trauma-informed perspective of like, when you're used to advocating for your needs so hard, if for, you know, for a newcomer, everything may feel like an emergency and feel like, if I don't get support right now, it's never going to happen. This is never going to be resolved. And so really talking to them empathetically about, you know, what is motivating this concern, either on behalf of the client or from the client themselves, reassuring them that not only are basic needs being met, but that you have a lot of perspective in handling a situation like this, and you know it's going to be okay, and reassuring them that it'll be okay. And then going back to that, aligning those self-sufficiency goals and expectations around like, this is why we do this the way that we do it, and this is the ultimate goal, and let's like get on the same page about how best we get there. And Christine, if there's anything else you want to add to that, please do.
Well, and I think some of this answer also aligns with some of the other questions we're getting in the questions box as well. And it's important to note too, that if you're coming from a staff perspective, how you answer, you know, a challenging conversation around expectations, conversations on success and self-sufficiency with volunteers is going to vary depending on your, you know, what's happening in your community at the moment, what volunteer you're working with. I suggest that locations that are utilizing sponsors and volunteers have a set point person for conversations about expectations and success for volunteers, so that when you know, an office is so busy that you cannot triage all of these questions that might come up, you are able to have somebody who at least is going to be able to reach out and answer, to reassure individuals. You know, because volunteers are your supportive community around you, and you don't want, you know, what is a simple misalignment on, you know, a successful integration in month 2 to come into an area of conflict down the line, you know, and want to meet that, you know, where it is. I have a few suggestions too on some of these other questions. There's one question that says, you know, is there a list of mandated expectations for self-sufficiency? I would suggest that working backwards on cultural orientation, looking at cultural orientation assessment, and what do we ask refugees at the, you know, close to the 90-day mark, you know, in assessing, like, do you know how to, you know, go to the emergency room? Do you know what health item, you know, preempts you to go to the doctor, the emergency room, or urgent care? Like, look at the cultural orientation assessment and kind of get glean from their knowledge of self-sufficiency from the program. And I don't want to undersell enough if you can swing it from a staff role, good communication, sitting down and planning between groups and the newcomer. Whether you are working with young moms, disabled individuals who are pre-literate, if you have a working service plan with them in the R&P program, and you're able to pull the service plan into a sort of plan that you're working on with a volunteer, saying, hey, this individual, part of their service plan is to apply for SSI disability services, then maybe the volunteer is going to be working on a specific element of that plan with that individual, but in a tiered sort of model, so that, month 4, 5, and 6, the individual is leaning less on the volunteer than they would be in the beginning. I'm going to pause for a second because I see we have a raised hand, and I also need to read through some of these other questions. We're getting good ones. Keep them coming.
Yeah, go ahead, Sharon.
You were saying about some challenges that we've had, or asked about some challenges that we had, or noticing emergencies, and all of the things you've been talking about resonates with me. I am a co-sponsor. We've been with the family almost going on 2 years. So our sponsorship was only supposed to last for a year, but we have extended it because the family that we have has just so much needs. They have no reading or writing ability in any language. And so just teaching them how to look at the mail and to do anything has been difficult. They're definitely learning. They're definitely coming a long way. We had about 20 people on our team. We now are down to about 12. Just ongoing, trying to make this family, it's a young mother with 3 small children, self-sufficient, has just been daunting. And it's like we don't see an end in sight. And then there's different people that have, like you said, are doing way too much hand-holding. Like they still take her shopping weekly. And not letting her try to do some of this on her own. So there's, been battles about, how do we do this? How do we do the self-sufficiency? And how do we have this checklist, like you said? What are the long-term goals? And then how do we work with that? I would love to have something like that we can write down. I know there's different levels. If you have somebody that's already literate in English, that makes it a lot easier. So there's different levels of needs from these refugees. And I guess I don't know if you guys have different checklists, like this is for somebody that speaks English. This is something that doesn't speak English. So we just need a lot of help about how we can do this, because we look at it as a multi-year process.
Absolutely. And we're not going to, Sharon, thank you for raising your hand and for giving this example, because I do want to note that, we're not going to be able to give, I think an answer that is robust enough to answer all the points in your unique situation, because it's we haven't been there. We don't know your group and the client and the family you're working with and their particular struggles. What I think in this moment, Katie and I can encourage is kind of a sit down conversation between mom and the group, and discussing, so what are her goals right now? What does she feel she needs assistance with from the group? And, if she doesn't list out grocery shopping, maybe that's an area that could be pulled back, weekly support for, or we're listing out all the ways that the group does continue to offer assistance, and then providing, an answer of what needs to happen in order for her to be able to handle that task alone. And then trying to bridge between, there's weekly grocery shopping assistance that's happening, what does she need in order to do grocery shopping weekly herself, and then coming up with a plan together between the volunteers who are actively doing that assistance and her, in order to move her to the next level. And it's hard. There's what Katie mentioned earlier about productive struggle. There's some of that in there. There's also going to be boundary setting where it might be uncomfortable for the person who has been assisting the family to grocery shop for the past 2 years. They might, need additional assistance from other co-sponsor members in the group, because it might be hard for them to step back as well. So there's so many elements coming at play here, and I think that's sitting down with a plan can help.
I think what I'm asking for from you is, do you have some task lists maybe that you can make public for us to use? And do you have, I'm trying to think of what would be, and who we can contact in the area that can help support? Once you're done with your resettlement agency and they've closed their case, what are the other resources that we could reach out to for help to take the client so that they can go to these other resources so that we don't have as much on our plate?
Understood. So I think that what we can do in wrap up from this presentation, and Joy, give us an answer if this is possible. If we can supply some links to some resources, but also some emails and some information about how to get in touch with RWC, how to get in touch with CWS, about, additional technical assistance. Perfect. Thank you.
Yeah, and just to chime in with that, and Philip, this kind of speaks to your question as well. Yeah, that tension between, it's like we have the capacity to do it, we can do it, so we should do it. And Sharon, when I hear you say you started with 20 and now you have 12, in my experience, burnout is real, and a lot of sponsors start off thinking they can do everything, and then they get burned out after years of grocery store shopping. So I love what Christine mentioned in terms of writing out the different tasks involved in going to the grocery store and then scaffolding it, right? And going, okay, in 3 months, or in 2 months, we'll drive you, but we're not going to help you pick out groceries or make a budget. Like that's on you. And then in another 3 months, we won't drive you. But in that time, we'll make sure you know how to get the groceries you need. We'll make sure you know how to get the bus to the grocery store, things like that. And Philip, for yours, yeah, really emphasizing with your sponsor group that it's not just about the doing of the task. It's about, in a year, if all of our volunteers are burned out, we've now have no energy left for the teaching, for the being the safety net rather than the primary go-to. And transportation is a quick burnout problem in my experience. So yeah, like Christine mentioned, we'll provide some emails for y'all and some links to resources that we can hopefully send out for, if any of you aren't working with local staff and you're interested in talking more about this and answering questions, we should have the capacity to do that, and our teams can help with that. So feel free to email us and reach out.
Thank you so much. And that would conclude our time for today. And yes, please feel free to reach out to RWC, feel free to reach out to CWS. We're here to provide those technical assistance to you and your group. And sometimes we need a third party to come in and just talk to the whole group, right? Sometimes it could be a sensitive topic that maybe the group itself doesn't feel as comfortable to bring up. So hearing from someone else to come in with some expertise in that is very helpful. And so please feel free to contact us, and I will be providing those emails where you can reach us. And again, the presentation and any resources and a recording of today's webinar will be sent out to everyone. And that will conclude our session. Thank you everyone for joining us today, and thank you to our presenters, Christine and Katie, for being such an awesome presenters. And we wish you a great rest of your week.
Thank you all.